Cognitive behavioral therapy, or CBT, is one of the main evidence-based treatments that are used to help reduce pain and with behavioral pain management. It is aimed at modifying social, environmental, and behavioral factors to alleviate or reduce pain. And I'll talk about each of these principles a little bit more, but the way that it works is it teaches kids to react to and think differently in response to pain, to teach them better coping mechanisms, to help them shift their focus away from pain. One of the things that happens in chronic pain is that becomes the center of a kid's life, and they are evaluating everything through pain. Am I going to have pain today? Can I do this? Am I not going to have pain today? Those kinds of things. And so through CBT, we're teaching them to shift that focus into other areas so they can incorporate more positive elements into their life. Positive elements, positive activity increases mood, involves the limbic system, makes that pain experience less. We need to eliminate unhealthy coping strategies that over time kids naturally have likely learned some things that might work in the moment, but over time can be harmful or actually reinforce some of that pain. Parents need to be involved. Without parent buy-in, this is not going to be successful. So like kids, the parents are going to need to learn to alter the way that they think and how they respond to their kid with pain. And we need to address any social or school problems. School can be a vicious cycle for a lot of kids with pain. So say you've got a kid with sickle cell who had a crisis and is in the hospital, also experiences chronic pain in between crises. They're in the hospital, they miss school, they get behind on their schoolwork, they are discharged, they go back to school, they're not in top-notch shape, they're still experiencing some of the remnants of the crisis, and then they're just regular pain. So not quite as focused as they would be. They have the stress of having to do their current schoolwork when they're not feeling good, as well as the added schoolwork of trying to make up what they missed. To add to this, it is unfortunately quite common for schools to not have a good understanding of pain, of sickle cell, cancer pain, and to assume and even tell the kids that they are exaggerating, that they are using it as a crutch, they're not applying themselves that they should. So then this becomes very stressful because there is extra work that they have to do. They're not feeling good. They are in an environment that is unsupportive. So we know stress increases the experience of pain. So school then can be a source of stress, which can increase pain, which can lead to missed school, which can increase pain. So without involving their social circles, we're setting these kids up to have a harder time.